Thank you. I just want to say in the beginning the thank yous, because as by now you probably know I have Alzheimer's, so I might forget. The other thing I want to remind you is that because I have Alzheimer's, I don't have a sense of humour. I have a great sense of humour. So thank you to Derek and the team. Thank you to Brennan and the Alzheimer's Society of Ireland, the Irish Dementia Working Group, my colleagues in it, and for supporting me, and Carmel Gagan, who's a volunteer who supports me and travels with me, and I'm very grateful to all of you. So I suppose today, thank you for inviting me to give my perspective on what patient outcome measures mean to me as someone using health and care services. I would ask you to please for a moment remember those diagnosed today with dementia. Every 3 seconds globally, someone is diagnosed. We still do not have 100% diagnosis, so therefore there's no cure. All we have is hope. Hope that someday we will have a quality of life. I was diagnosed at 62 after a 5-year struggle of wondering what was the matter with me, forgetting words, stopping mid-sentence, wondering what I was about to say, not remembering what my husband and son had told me or asked me to do, never getting the in-tray delegated. And I can still feel the burning silence when sharing a meeting and my concentration disappeared, and then trying to cover up and cover up again. So getting a diagnosis was important to me and my family. My life would never be as it was. How do you tell your loved one you may not remember them in an undisclosed amount of time, or remember all the memories you had banked along the way? At the time of my diagnosis, I required a pathway of care for my new life, my life with Alzheimer's. And so this was my first encounter with value-based healthcare, and the great lack of it. There is no pathway or plan, nor support. Just get on with it. Go home and get on with your life. So we're here today because we're all interested to learn more about the patient perspective and how we can embrace a more value-based healthcare approach towards meeting our healthcare challenges. As a person diagnosed with Alzheimer's, I can tell you how it feels and impacts my life and why value-based healthcare is important to me. I want to remind you that I'm more than a patient or a collection of symptoms. I'm a person, I'm a mother, I'm a wife, I'm a sister, I'm a friend, and I have a full and varied life. I want to access healthcare services that support my life, that allow me to be the independent woman that I am. Early diagnosis is very important, as this helps to remove stigma and lets us try to get on with our lives. Outcome information could have helped me so much when I was diagnosed, but there was no information on trajectory and impact on my life. Having an outcome, I would live well and be active, and it would have helped. I was forced to learn that along the way. Information on services supports and what actually is Alzheimer's. These are outcomes I would just love to have had. So I've been privileged to be part of a group that has developed the International Consortium of Health Outcome Measures. And I remember the first time that Alistair Burnett asked me to be involved with the International Consortium. He was doing some research with the International Consortium of Health Outcome Measures, and I got the information. But it was in the virtual world, so we were all around from, I always say, from Peru to Tubbercurry in Sligo. So it was, I looked at all this information that I got, this pack of paper, and I'm thinking, not paper, online, and I'm thinking, gosh, there's something really missing here. There was something great missing. There was Helen's quality of life, and there's quality of life for every patient. So I'm delighted to tell you that with the help of ICHOM, we were able to change that, and I was able to influence change around the world, that we must look at our quality of life. The standard set of dementia was very important to me, because it's going to transform healthcare systems worldwide by measuring and reporting patient outcomes in a standardised way. So we urge all healthcare providers around the world to start measuring patient outcomes and better understand how to improve the lives of people with dementia. There's one other aspect to it that I always like to remind people. because I would like to remind you, you're the taxpayer. And if we don't have good outcomes and measurable outcomes, guess who's paying for my care in a home? You. So I think it's important that we don't lose track of the economics of outcomes as well. And Derek is probably thinking down there that I'm spending too much time around Eamon O'Shea down in NUIG, the economist. So any discussion of value-based healthcare should define measurements. In other words, what has been measured and who decides it? Person-centred care is a much-used term. It is used by clinicians, academics, scientists and advocates. But I want to pause and think about the reality of person-centred care. It is essentially bespoke care, a type of care that puts true value on my will and preference. Care that acknowledges each person with dementia is unique. I have different needs compared to my colleagues in the European Working Group of People with Dementia or the Irish Group of People with Dementia. To be person-centred, you just must know me as a person, and care must be responsive to my unique needs. And while I am positive about value-based healthcare and measuring outcomes, it is important to emphasise that those outcomes are different for each person. Another thing I want to consider is that it is all too easy to become lost in a system that has little or no understanding on how to respond to people with dementia. Measuring outcomes can have an impact on understanding. If what we measured is not just about hard medical needs, measuring my mobility, my hearing, my sight is easy. But have you considered measuring my empowerment, my sense of well-being, my independence? These are equally as important. This is an important message I want to deliver to you today. Don't measure on our health issues. Measure on my more complex needs. Put time and money into my personhood, because at the end of the day, my quality of life will have a profound effect on healthcare. Kitwood wrote about personhood in the 90s. It is widely accepted and held up as a core dementia care. He set out needs such as inclusion, attachment, comfort, and occupation. And yet now, more than 20 years later, those needs are not adequately measured. I have certainly never been asked by a medical professional about comfort or attachment, about what brings me joyful occupation in my life. So my advice to those of you seeking to add value to my health outcomes is to ensure you measure all my needs. But to meet my needs, the people delivering care must be appropriately trained. I do not want to be cared by a person who does not have the skills to respond to my unique needs. Therefore, value-based healthcare must look at staff outcomes as well. They too should be empowered. Staff personhood must be valued and acknowledged in the same way as mine is. We must see each other as human beings. I believe staff must receive quality dementia-specific care, and the rates of training should be measured. When I think about value-based healthcare, what it means to me personally, I think about my human rights. And I think many of you in this room that know me will know that I'm a long-time advocate of human rights. In Ireland, we have a Charter of Rights for People with Dementia. I was chair of the Irish Dementia Working Group when that charter was developed. The charter seeks to promote the respect, protection and fulfilment of the human rights of all persons with dementia. I've been involved, as I said, in advocating my whole life. I worked for a long time in the disability sector. I see human rights as fundamental, a core part of any service. Sometimes I get frustrated that I'm still speaking about human rights of the person with dementia. I wonder, do clinicians in the care system consider the human rights of the person with dementia? Ireland recently ratified the Convention on the Rights of People with Disabilities. My dementia is a disability, and if I apply a human rights lens to my life with dementia, this is the view, and it's a very mixed one. My right to life in my community is infringed because I do not have a statutory right to home care. My right to the highest standard of health is infringed because I live in the west of Ireland where services are patchy and there's huge geographical inequality. This inequality also exists across the country. Article 26 says I have the right to rehabilitation, yet cognitive rehabilitation, rehabilitative, stimulation or behavioural therapies are not widely available in this country, and they're certainly not widely available where I live. But they are now much more freely available in the UK. Indeed, the Irish Charter sets out that I should have my independence maximised, yet there are not enough supports for me to do that. My right to participate in social and cultural activities is infringed. because not all cultural institutions are aware of the sensory challenges which dementia brings. If I was in a wheelchair, you would not think it unreasonable for me to look for a ramp. Yet because my disability is invisible, the supports to live well are not as easy to ask, and it's not as easy to ask for as a ramp. I will encourage human rights to be the starting point of value-based healthcare, because in my experience, my health outcomes are affected by whether my human rights are fulfilled. I believe social citizenship matters because rights are also about our social and economic rights. We need distributional fairness to stop inequalities. These can also influence outcomes. So I feel positive about value-based healthcare. Some of the business part of my brain still works, and it frustrates me as I watch the waste in our care system. IPPOSI carries out immense work by highlighting the need in Ireland to embrace a more value-based healthcare approach towards meeting our healthcare challenges. We must continue to understand the patient experience and perhaps explore further ways of measuring the quality of our healthcare. I want to see all of us use the same language, especially GPs, consultants and pharma. I want to urgently see outcomes on medicine and ask why it is taking so long. And I have been asking that for a very long time, because I just want to briefly say before I finish why I ask. We want to see, we have medicine on this market that's supposed to stop our progression, supposed to, may I add. It has horrendous side effects, and yet we have no outcome measurements on it. So it's important that we have outcome measurements. I want to see outcomes on psychosocial interventions, which is not just about quality of life, but should also have a positive economic outcome. Including the voice of the person or patient is so very important, and we don't want tokenism. We are usually asked at the last minute, can I just tell you? But we live above it. We can give our experiential knowledge, and we want to be part of the solution in improving health outcome measurements. So preparing for today, I read a quote about inclusion. It said, "Diversity is being invited to the party. Inclusion is being asked to dance." While those of us living with dementia have our dancing shoes on, we may not all be too good at it, but we're ready to contribute. Just ask us. We want to see good quality healthcare. We want accountability. We want the very best surveillance, and we want good collaboration with all to ensure the best outcomes for everyone. Thank you again to IPPOSI. I know that we will all work together, and you know that by us all working together and acknowledging the patient, we can make it. Thank you.